Hello, the topic today we are going to discuss is about hiccups or hiccup. It is nothing but a sudden involuntary contraction of the diaphragm. So we have a chest and abdomen. The chest and abdomen is separated by a strong muscle, involuntary muscle called diaphragm, which it moves down, it brings in air, and when it moves up, it pushes the air out of the lungs. That is the function of the diaphragm. When the diaphragm is irritated or disturbed, it can cause spasm, violent contraction, which pushes the waves into the vocal cord, and the vocal cord makes the sound, the snapping sound. That's called hiccups. So, what are the reasons why hiccups happens? Is first thing is we always say the diaphragm. So, any organ which is attached or touching the diaphragm, when it's diseased or disturbed, can cause hiccups. The organs above the diaphragm is the lung. Suppose you have a lung infection, pneumonia, your pleurisy, that can irritate the diaphragm, and you can have a hiccups. And you have a heart. When the inferior wall of the heart gets, getting into ischemia, that can irritate. We call it inferior wall ischemia. When it, that can irritate the diaphragm, and it can cause irritation. But most of the time, hiccups is a natural phenomenon that can happen to anyone, and which can, without any treatment, it can, get cured on its own. But we should look for other reasons, especially like heart and lungs. Then below the diaphragm, we have a foot pipe, stomach, and liver, which are directly touching the diaphragm. So any diseases in the stomach, like ulcer, or even some tumor or cancer, especially the fundus of the stomach, which is touching the diaphragm, or even a food, dry food, rice or something which sticks to the fundus can irritate or in the foot pipe, junction, because of the acid reflux, the food stuck there, it can cause hiccups. It's a violent contraction, to displace the irritation, the food or something, we get the hiccups. So in the foot pipe or in the stomach, any ulcer, or sometimes the ulcer is bleeding, then it can irritate the stomach and cause hiccups. Then comes the liver. Any problem in the liver, like hepatitis, inflammation, or even infection, or even gallbladder problem can trigger can irritate the diaphragm and can cause hiccups. And other organs also can cause, like suppose you have a kidney problem, and increased urea, creatinine, and the toxic things can centrally stimulate the hiccups. They can cause violent contraction of the diaphragm. And smoking and alcohol, another main reason, especially too much of alcohol and smoking, nicotine can cause trigger the contraction of the diaphragm, causing hiccups. And other medications, even levodopa is one medicine given for neuro problems, can cause. And any medicine given for acid reflux, you should acid reflux. To prevent acid reflux, we use certain medication. As a side effect, they can cause hiccups. And eating fast without chewing properly, eating fast, drinking too much of water, that can cause. And suppose usually the hiccups goes off after some time, maybe a few minutes to a few hours, that can automatically go off. But if it remains there and it disturbs your day-to-day activities, like because of the hiccups, you cannot work, you cannot concentrate on certain things. And if it is more than 48 hours in spite of treatment, then it needs to be taken a little seriously. Even the strokes, the neuro problem, tumors can cause hiccups. So if suppose the treatment, I suppose without any, within 48 hours, the hiccups doesn't go on its own, then you have to definitely go to see the doctor. Probably they will do the blood tests, investigations, and even they will ask for an endoscopy. In endoscopy, if there is an ulcer or tumor, they can take a biopsy, or if it's a bleeding, they can do something to stop the bleeding. and even sometimes they can give a stomach wash during that time. And so generally we say hiccups can happen normally to anyone, and it usually temporary and it can get cured on its own. It can happen to anyone of any age, and it's usually because of without chewing properly, eating very fast, or having too much of water, or even smoking, alcohol. This can cause hiccups, and it can, if it is not going on its own, even after 48 hours, definitely you need to see a doctor and you can get cured. Thank you.